All right, hey everybody, it's Rebecca Gordon with Gordon Marketing. And I'll start over. Okay, hey everyone, it's Rebecca Gordon with Gordon Marketing. And I want to thank you for listening into the health ministry trainings that we've been doing. Remember, on YouTube, I have several training videos. And if you haven't subscribed to our YouTube channel, you need to do so. Sylvia puts videos out there, Randy does. You know, what makes Gordon Marketing unique is that we cover all 4 national divisions. So senior, health, annuity, and life. When we do some new training, we make a video, we shoot it out on YouTube, and all of our subscribers get that information quickly. So you definitely want to subscribe so you are in the know. All right, I want to show you how to, once you pass your certification with Altrua, what's going to happen. You're going to get an email. It's going to look like this, and it'll come from Bob. And it's going to say, welcome, I want to congratulate you. You're going to log on here. We're going to go to our agent portal now. So all of your apps, you can do them with the paper app. Don't do it. Do an online app. It's foolproof because the system won't let you go to advance to any other pages if you leave anything out. So do them online, super easy. This is how you do it. So you're going to take your welcome letter. You'll notice here I have a username and I have a password. You will notice they are the same. Once we go onto the home page, I'm going to change my password. You'll do that as well. It says you can log on by going to altruahealthshare.org/representative. Now, when you do that, this is probably going to pop up, which they're aware of. It's not a big deal. All I want you to do is just backspace, and go in that way. So here we go. Now, you will notice that I'm already logged in. For you first-time users, it's going to ask for your agent ID and password. It's going to be those 2 numbers, which are identical, that came from the email. Once you put those in, it's going to ask you for a different password. Create your new password. And then it will say your name over here. And this is your home page. Super easy. All right, so we're going to come over here. Resource documents, beautiful. We get the brochure, we get the information booklet, our height and weight chart, CMS approval letter, medical conditions that are subject to automatic denial. So remember, these plans are not guaranteed issue. They are underwritten, and this is a nice list of automatic denials. You can look at this. This is at your fingertips. So under resource documents, there's also some sales presentations. So a lot of great information here. If we go over to our application inquiry, this will be where you will find your list of applications. So right now I have one in there. If I was to type my last name and hit enter, it's going to bring up that I did an app already. My client's name is Test. I started it today. This is when I submitted it. Now you'll notice my status says denied. They've already denied me. They knew this was going to be a test. But this is your dashboard, and you need to be on your dashboard daily to see what the statuses will be. So we're going to go up to application. This tells you what you need to be prepared to do an app. It also tells you down here about being over 40, shows you your payment options, and we're going to go to continue to online application. And now we're going to plug and chug. So wherever there's a box, fill out the information. Again, what's really nice about this is that if I miss something, it's going to go back, it's going to make me put it in. Social Security number. This could be a visa. If you have someone who doesn't have a social, your employer, your occupation. Does each person have to be a U.S. citizen? You don't have to be. The reason why they're asking you this question is that in the event you have someone who's coming from Africa, Altura wants to know where they're coming from in the event they need more testing done, right? So if someone's coming from, let's say, Brazil, I don't know, and there has been an outbreak of some disease in Brazil, we may want to have some more tests performed before we insure them. So it's not an automatic stopper if they're not a U.S. citizen, but I'll say yes. If someone is ineligible, would the rest of the family still like to join? So yes. So if we're not sure about maybe dad, maybe he's going to be on the fence a little bit, will we still want to continue with the rest of the family? Now remember, we have two plans, a standard and an advantage. I'm going to go ahead and select that standard gold. How did you hear about them? And if we have a spouse, notice they need height and weight. Speaking of height and weight, there's mine. So we're going to go ahead and put mine in. Put my gender in there. I'm not going to do a spouse. I'm not going to add any of my kids. I'm just going to go continue to medical. You will notice my date of birth is invalid. Oh, well, all right, let's make it correct. So I really think the system is super slick. It's very friendly. And I always love things that are foolproof so that if I get going too quickly, it stops me. Here are your medical questions. So you need to read through these. What I want to do though is I'm going to hit yes to this, the question on infectious diseases. I want to show you what's going to happen. So I'm going to hit no to the rest of these. Remember, with your effective dates, if you submit a completed application between the 1st and the 25th of the month, you're going to get the 1st of the following month. If you submit a completed application the 26th to the end of the month, you'll get the 1st of the following month. So now let's go ahead and hit continue. I answered yes to infectious diseases, which would be terrible. Boom, it's popping it up. It wants all my information. Let's say I have to go backwards. Oh shoot, I have nothing infectious. I can do that. I can hit no, and I can continue. We're going to continue. This question is, for each applicant, for what conditions have you seen a doctor in the last 3 years? So it says even for wellness. So I'll just say a routine pap and mammo. And then it's going, has anyone been hospitalized? Again, more questions. You'll notice this program is looking for the healthy. It is looking for the folks that are in good shape. What was your weight 1 year ago? So go ahead and put that in there. Right here, this is asking for adult females. Enter your last gynecological exam. So we're going to put that in there. And the same thing for mammo. So remember, if you're 40 or over, you're going to have to submit documentation that you've had your physicals, that you're in good shape. Now look, this is a question number 15 about prostate. Well, I'm not a guy, so it tells you to put NA, and it says it right here. Any untreated symptoms? No, no. Any cancers? No, thank goodness. No, no, no. And just because you say yes doesn't mean that it's an automatic ding. This last question, are you a veteran? Are you eligible for VA benefits? They're looking for that coordination of benefits where maybe the VA would be primary. All right. For adults, are you or could you be pregnant? I missed that. That is not a way. We're going to hit continue. Here's my acknowledgments. Here's my statement of standards. Remember, that's what sets Altrua's Health Share Ministry apart from other ones, is that it's based on a statement of standards. And then here we have our commitments. And now we're going to go and talk about the escrow. Escrow accounts, here are our signatures. And it says here, by signing here, I acknowledge that I have read and I understand the following: recreational limit, activity limit, pre-authorization, cancer eligibility, and maternity under our sharing limits in the back of your information booklet. So, as a person representing this, you need to make sure that in your presentation, you are covering these things. And it's very easy. Have your information booklet out for your client and highlight these things. We're going to type in your signature. Type in and you will notice it does want the date. I'm going to type in my signature again. I'm going to do my date. And I'm going to type in my signature again. This is a very nice system. Remember, with the maternity benefit, you have to be on the plan at least 10 consecutive months. You have to have at least one other member on there. Now, here's our payment. We can either do, it can draft from a checking account or savings or credit card. If they do a credit card, the member will be responsible for the 3% fee. Go ahead and add that, and we're going to hit continue. This is the application checklist. Your application fee for $100 and the ministry fee of $25 will be added to your first monthly contribution. If denied, we will deduct only the ministry fee of $25 from your account. We're going to type in my name again. We're going to put in the date. And we're going to hit submit. And we're done. Now the next thing that's going to happen is I'm going to start getting some emails. And I will show you those. And so to recap, once you pass your exam, you're going to get a welcome email. It'll come from Bob Dieterich, trainer at Altrua. You will have a username and password. Those two will match once you log on to altruahealthshare.org/representative. Once you log on, it will ask you to change your password. So that's where you can make that anything that you want. On your dashboard here, we have resource documents. This is where we can put our fingers on brochures, information booklet, height, weight. Application inquiry, this is our dashboard. This is going to show us and keep track of all of our pending business. And of course, when we want to enroll someone, we're going to come here to application. Now, I just received my email, and I'm going to show you what it looks like. So you'll notice application team from Altrua HealthShare Online. So if I open that up, it's going to say, thank you for putting your faith and healthcare needs in our hands. Your application has been received by our application team. Once you receive, you'll receive an email letting you know your status. Excellent. So there's that. And then I'll start getting updates based on if if they need anything else, or if I have been denied, whatever the case. So then you come into your application site here. I'm going to type in my last name. And here's my second app. I just did another app on Rebecca Gordon. Wow. And it'll show that she's been submitted. And that's my portal. Very, very easy. So if you have any questions, absolutely email myself or Jordan Quinn. Jordan is helping to spearhead this new membership plan that we're working with. And of course, if you need anything from our team, call us at 800-388-8342. Have a great day, good selling, and I'll talk to you later.